briefer. I'm going to grade Hillary Evans' assessment and I'll be the recorder.
Hello.
Hello. If you would have a seat for me, please. So as he was walking in, I was observing his gait, which it was smooth and fluent. He didn't have to use any assistive devices to help him walk. So anyway, my name is Hillary and I'm a registered nurse and I am going to be working with you today.
Okay.
So for privacy and confidentiality purposes, instead of me asking what the patient's name is, I'm going to have him tell me his initials of his name. Can you tell me your name?
R.E.
R.E. Is it okay if I call you R.E.?
Okay.
Okay. Well, it's nice to meet you. Can you tell me your age, gender, and your occupation?
66 years old. I'm a male, and I do home improvements.
Home improvements. Okay. So can you tell me the date, such as the day, month, and year, and the day of the week?
And this is December 1st, 2023, and today is Friday.
All right. So based on his responses are clear, fluent, articulated, they're logical, coherent. His appearance, based on my observation, is appropriate for the season and the situation. And now I am going to be starting your physical assessment, okay? First of all, what I want to do is I just want to look at your skin, okay? So I'm going to stand over here. All right, if you would
Are these
uncross
in your way?
No, they're fine. I just want to, keep your legs uncrossed for me. If you would put your arms out for me. I'm just looking at your skin of your face, your arms, your hands, and your legs. And if you'll turn it back over, I'm gonna look at your palms, and then turn your hands over. So I don't see any lesions, any rashes, any redness. Skin's intact. Now I'm just gonna feel for just keep your legs uncrossed. I'm gonna feel the
I always wondered why they do that when I'm at the doctor's office. Okay.
I'm gonna feel the back of with my hands, your skin for temperature, okay? All right. So his skin is warm and not too moist and not too dry. Also with his skin color is appropriate for his ethnicity and also even in pigmentation. Now I'm just going to assess your scalp and your head, okay? All right, so I'm looking, and your hair as well. So I'm looking at your scalp and your head. So his scalp is normocephalic. I don't feel any lumps, bumps, bruises, or anything like that. His hair is clean cut and well groomed. Also that goes with his appearance too. He's dressed well groomed. I don't see, or I didn't feel also any scaling or anything like that with his scalp. Now I am going to look at your eyes. All right, I'm gonna look here. I'm gonna look at the conjunctiva at your eyes. I don't see any lesions, any redness, any injury or anything like that. They're pink in color, which is normal. Now what I want to do is I want also too, I'm gonna look at the white part of your eye, which is the sclera. I don't see any lesions or any abnormalities. I don't see any injury. They're white in color, that's what it's supposed to be. Now what I want to do is I want to assess your eye movements and the pupillary response, okay? So if you'll just look at this pen light, don't move your head, and just follow and move your eyes as I move this pen light, okay? So the patient was able to move his eyes, which were strong, and able to move them in the 6 fields of gaze, and that tests the, with the lateral movements, it tests the cranial nerve 6, which is the abducens, and then it also tests the cranial nerves 3 and 4, and now I want to look at your pupillary response when I shine this light in your eye, and it's gonna be bright, okay? So I'm just fair warning you, okay? Just keep looking straight ahead for me. All right. And his left pupil constricts as I shine the eye through his eye. Yeah. And then I'm gonna do the other eye. Okay, that one also constricts as well. As I shine the light through his eyes. And then also I'm going to take this pen light here and keep your head straight. Okay. And I'm going to move it, and his pupils are back to dilated like they were originally in the original state. Now I'm going to move this. Just follow your eyes with this pen light, okay? Alright, so as I move the pen light towards his nose, his eyes constrict, and I'll also go inward, which tests Perla, which the pupils are equal, round, and reactive to light. Let's see here. Alright, so now what I want to do is I'm just going to look at the inside of your nose, okay? Actually, I'm looking at his nose, and his nose is midline, and I'm just going to look in the inside of your nose here. So the nasal passages of the nasal mucosa are pink. There's no lesions, no redness, no drainage.
A little bit dry today.
No bleeding or anything like that. And so what I want to do is I want to test for the patency of your nose, making sure you don't have any trouble breathing. So I'm going to test one nostril first and then do the other. So when I cover one nostril, you just take a sniff. All right. So based on my observations, he has no trouble sniffing, so his nostrils are patent. Now what I want to do is I want to test your smell. So if you would close your eyes for me. So I'm going to wave something underneath your nose, and you just tell me what you smell.
Coffee.
All right. All right, now I'm going to do another one.
I really can't pick that one up very well. Oh, alcohol. I got it.
Okay, so based on your responses to that, I can tell that the cranial nerve 1, the olfactory nerve, is intact. Now I want to look at your ears.
Okay.
First of all, I just want to, turn your head here. Turn it the other way for me. Okay, so looking at them, they're symmetric to the patient's facial features. Now I just want to take my pen light and I just want to look into your ears. I don't see any redness, lesions, anything obstructive, no injury. Looking throughout all the ear, around the ear, there's no redness, lesions, or swelling or anything like that. We'll look at the other side. Same thing, no lesions, no redness, no injury or anything like that. So now what I want to do is I want to test your hearing, okay?
Mm-hmm.
So what I'm going to do is I'm going to have you, what I'm going to do is I'm going to cover up one of your ears and then I'm going to whisper some words and you just tell me what you hear, okay? I'm gonna kind of come on the other side so you can see. All right, we'll cover this. 3Z2.
3Z2.
Yeah. Okay. All right, and then I'm gonna come over here. Sorry.
AB2.
Good job.
Oh wow.
All right,
I
so
wasn't sure. It was close.
yeah. So based from that, the patient's hearing is intact, which goes with cranial nerve 8, which is the acoustic nerve. Let's see here. Now I want to just assess I'm going to look at your lips,
Okay.
which they are a little bit pinker than the patient's face color, which is normal. The lips are appropriate. There's no extreme dryness or crackness or lesions or anything like that. I just want to look inside your mouth. All right, just looking here. All right, so the mucous membranes inside the mouth are pink and moist, and also the teeth are all there and intact. They're straight, they're white. Also, when looking at the gums, they're pink in color. There's no redness, and they're tightly fit around the teeth. There's no lesions, no bleeding or anything like that. And now what I want to do is I'm going to look on the upper roof of their mouth. There we go. And if you could say it. All right, hold on. Let me get my little pretend tongue depressor here. So what I want to do is I'm gonna put this tongue depressor on your tongue, and you kind of like meet resistance, okay? There we go. There we go. There we go. Good job. And then if you'll say ah for me there, we're good. All right. So the testing of the when I'm looking at the uvula it tests the cranial nerve 10, and then also too whenever I was looking at the inside of the mouth too, it was assessing the cranial nerve 9, which is the glossopharyngeal nerve. Now I also want to do, so if you can smile for me. All right, so the patient's smile is symmetric, and then I'm just going to feel for the temporal joint. Can you clench your teeth for me? Are you clenching your teeth?
Mhm.
Okay. And then,
Excuse me.
Can you puff out your cheeks for me? All right, that tests the cranial nerve 7, which is the facial nerve. Let's see here.
I can do that too.
Can you?
X types one.
All right, I'm gonna put my hand upon your shoulder. If you can, kind of shrug up for me. There we go. And then also, I'm gonna put my hand here. If you could try to meet resistance there. All right. That tests the cranial nerve 11. Also, yeah. Can you put your head up, down, left, right?
Oh.
Sorry, you're looking at me.
Yeah.
So, anyway, and then also that tests the cranial nerve 11, the spinal accessory nerve. So, 2, what I want to do is I want to test the sensation of your face. So I'm just going to touch and can you feel that?
Mm-hmm.
All right. Well, sensation's intact. So doing that, and also when I was having the patient clench their jaw, that tests the cranial nerve 5, which is the trigeminal nerve. And can you say the phrase for me, light, tight, dynamite?
Light, tight, dynamite.
All right, so that tests the cranial nerve 12, which is the hypoglossal nerve. All right, and let's see here. Okay, so now what I want to do is I want to assess the back part of you,
Okay.
like your lungs and your heart and all that stuff. So I'm just gonna be back here,
Mm-hmm.
and what I want to do is, and also too, I forgot to mention. So while the patient is sitting in the position, he is sitting erect and has a good posture. So the posture's good there. And what I want to do is I am assessing the back of the, basically the chest expansion or whatever, diameter, which I don't see any barrel chest, so no abnormalities there. And what I want to do is I'm going to check the symmetric part of the of the rib cage. So when you take a deep breath for me, can you take a deep breath? There we go. All right, can you do that again for me? All right, good. So that's symmetric bilaterally. And now what I want to do is I want to I want to palpate for any resident
Residual.
no, not residual.
Go ahead.
Anyway, what I'm going to do is I'm going to take the ulnar part of my hand, and when I touch, you just say 99, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right, I don't feel any abnormalities there. What I want to check next is I'm gonna percuss and make sure that there's no abnormal resonance when I tap. Okay.
Mm-hmm.
I'm also checking for any tenderness or anything like that. Any tenderness when I?
No.
Okay. So I hear just normal resonance, no abnormal sounds, things like that. Now what I want to do is I want to listen to your lungs on the back side, okay?
Yeah.
And so when I move my stethoscope, or when I place it, I'll have you take a deep breath, okay?
Okay. Don't need to raise my shirt or anything.
No, sir. I mean, you can if you want to, but
It's up to you.
can you take a deep breath for me? All right, from listening to your lung sounds on the back, they're clear bilaterally, no adventition sound. So now what I want to do is I want to do the same thing on the front of the lung sounds, okay? So I'm going to do the same thing where I'm going to with the front part, with your, if you can just take some normal deep breaths for me. So with the diameter, I don't see any chest barrel or anything like that. So now what I want to do is I want to check the symmetrical whenever you take a deep breath. All right, so chest expansion is bilateral when he takes a deep breath. And I want to do the same thing that I did on the back with the palpation. So I'm going to do the ulnar side again, and when you say 90, when I place, you just say 99, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right, I don't feel any abnormalities there, so that's good. Now what I want to do is I want to percuss like I did on the back side. Any pain or tenderness there?
No.
Okay, so just normal resonance, no crepitus or anything like that, where for any kind of fluid or anything like that. Now what I want to do is the same thing on the back. I want to just listen to your lung sounds on the front, okay? vegetation sounds, clear, lungs are clear bilaterally. I don't hear this on the front and back. I do not, or the anterior and posterior of the lungs, I didn't hear any wheezing, any rales, rhonchi, or anything like that. They were clear bilaterally. Now what I want to do is I want to listen to your heart sounds. Okay, so first thing I want to do is actually, if you can, I know this is going to be a little bit difficult, but if you could kind of recline back just a little bit, about 45 degrees. If you can turn your head to the right for me. All right, I'm just looking for jugular vein distension, which I don't see any. I'm going to come over here and look at his right side. I do not see any JVD on the other side as well. So if you can sit back up for me. And what I'm going to do is...
You should have just at least pull me up.
Sorry. Anyway, so what I'm going to do is I'm going to feel for carotid pulse, and I'm going to do one at a time because you don't want me to do them both because you might pass out. Alright, the carotid pulse is +2, strong, well, regular, and on the other side it's +2 and regular. And then now what I want to do is I'm going to check for any bruits. Which I don't hear none, which is good. That's normal. All right. And one of the things that I missed, I'm going to go back to it while I'm looking at your face. I'm just going to check your sinuses, okay? Any pain or deep tenderness there?
No, ma'am.
About, so this is the frontal, and then I'm going to check the maxillary. Any pain?
No.
The patient should feel just some firm pressure, but no tenderness.
Yes.
Did that. Now I want to go back to listening to your heart sounds. I'm just going to listen to your heart here. So the last place I listened was at the apical pulse, which is the point of maximal anyway, the apical pulse, I listened to it for a minute, and it was the heart rate was 63. The pulse was regular. And if you could you lay back for me for a minute?
All the way back.
Yeah, all the way back. Okay, and if you can, turn your body, not all the way, just enough slightly to the
Left.
Yeah, not all the way.
Okay.
Yeah, not like that. Alright, so I am feeling for the apical pulse, which is at the 5th intercostal space, mid-clavicular line. Here we go. And you can lay on back and then continue to lay down, because now what I want to do is I want to listen to your belly. Okay. First of all, what I would do if you didn't have your shirt on is I would inspect your belly.
Well, you're welcome for me to pull it up.
Well, that's okay. So anyway, I'm looking. I don't see any any abnormalities. I don't see any lesions or redness or anything like that. So now what I want to do is I want to listen to your bowel sounds, okay?
Okay.
And I'm listening in the 4 quadrants. All right. So the bowel sounds are active and present in each quadrant. Now what I want to do is I want to palpate your abdomen, and I'm going to first doing a light touch. So basically what I'm doing is I am feeling for just the superficial of the abdomen. Is there any like pain or tenderness when I touch you? Okay. So now what I'm going to do is I'm going to do a little bit of a deeper pressure. Any pain or tenderness there?
No.
And then I want to do even deeper pressure, and this feels for like the organs and any enlargement or any abnormalities there. All right. Any pain or tenderness there? All right, good. Now what I would like for you to do is if you could sit back up for me. And I am going to have you, we're going to assess your range of motion. So if you can like stick your arms out for me and turn them over.
All right.
And then kind of bend them like this and out. So basically you're flexing and you're extending your arms. And then if you can do that for me. So flexion and extension. All right, and then just move your arms like this. All right. If you can put your arms up for me. There we go. And down. So basically when he's moving his arms away, that's abduction, and bringing him back to his body, that's adduction. Any issues there? So his upper bilateral extremities are active, and all his upper extremities. So range of motion is intact. And what I want to do is also I want to assess your strength. So if you can, there we go. So he's got a strong grip. Now what I want to do is feel for some more pulses. So I'm just going to assess your brachial pulse, which is good, and +2 in regular. Now I'm going to check your radial pulse. All right. And those are both regular and +2 bilaterally. And also I want to go back and when I'm looking in your mouth, I'm just going to assess your tonsil. Can you say ah? All right. And so anyway, looking at his tonsils, they are +1 out of 4, which is normal. And now what I want to do is going back to your fingers, I'm just assessing capillary refill.
What are you doing?
Capillary refill. Basically,
comes back.
Capillary refill, when you squeeze it, it should return back to its
Never seen it before.
Anyway. And then also too, I'm just going to pinch your skin. I'm going to check your skin turgor. All right. So his skin turgor is non-tinting, means when I pinch the skin, it goes back to its normal shape without staying for a good length of time. And now what I want to do is I want to assess your range of motion in your legs. So if you can, also with going back to the hands, I want to, if you can, pull towards you.
Okay.
Okay, and then, yep.
Okay.
And then also, if you can, what I want to do here is have you try to pull out. All right. Now going back to the legs, what I want to do is I'm going to put my hands here and you pull them towards you. There we go. All right. He has good strength down there in his feet with the dorsiflexion, and you can just rotate your ankles around for me, kind of like
Snap, crackle, pop.
kind of like this. Can you rotate them some?
Well, yeah, I think so. Some.
Okay. And now if you can extend your legs out for me, there we go, and bring them back, like you're flexing them. And then basically, if you can you move your left leg out towards you? There we go, and bring it back to your body. So moving it out, you're abducting, and bringing it in, you're adducting. Can you do the other? All right, bring it back. All right. Let's see here. Now what I want to do is I want to feel first some pulses.
Okay.
Your popliteal pulses.
Fingers are cold.
Let me do this. Alright, that pulse is +2 in regular. Alright, and that pulse is +2 in regular. Now I'm going to check is the dorsalis pedis pulse. Alright, that's +2 in regular. Now for the dorsalis tibial. That's +2 in regular. Okay, so now what I want to do is I want to assess your cerebral function. So the first thing I want you to do is I want you to put your hands flat on your knees.
Okay.
Or not your knees, sorry, your thighs. And then turn them over. And turn them back. Turn them over. Keep doing that as fast as you can. Alright, so the patient's his cerebral is intact, there's no abnormalities there. Then what I want you to do is take your thumb and touch each finger and then go back. Alright, and do it with the other one.
That pinky trigger don't quite want to make it.
Alright, so anyway, being able to do that with coordination, that also means his cerebral function is intact, no abnormalities there. Now what I want you to do is I want you to take your right heel and go down the shin of your left leg and do the same thing. All right, the patient was able to do that without any problems. So the cerebral function is intact there. Now what I want to have you do is I want to have you stand for me. All right, and I want you to close your eyes. I want you to put your hands by your side and close your eyes. All right, the patient was able to do this without, you can open your eyes, without any swaying or anything like that. So the Romberg test is negative. Now what I want you to do is I want you to bend over and like you're touching your toes, and I'm looking at your spine here to see a C curve, which I do, so that's normal. And I think that's it. You can have a seat. Thank you for your time. Please don't fall.
All right, all done.
Finished?
I can stop it. How do I stop it?
Here's one you didn't have any